What methodology is that?
Cavolo, una parte. Ne uno più un se devi effettivamente.
Um, a panelist on media also. Williams.
No, you're not muted.
Happening. We can't hear you clearly. I can't hear you clearly.
I can hear us clearly.
Fatima, you can hear?
Yeah, it's fluctuating.
Yeah, it's the same for me.
Yeah, same here.
Luna, yeah, I can't hear anything. It's kind of cracking something.
But
This is
Mine. Okay.
okay. Okay. Um, um, um,
I can't hear you.
I can't hear you either.
Yeah, I can only hear the people on Zoom, but I can't hear anything from the room.
Okay. Okay. So what I'm saying is,
What's happening?
When we get sounding muffled, if you can hear sound, so you can't tell what exactly he said.
okay, we're just trying to get things settled.
Can they check the mic? I don't know.
I'm trying coming from one of these. Like, wait, I think his mic is on. Our for mic is on. Try to. Huh? No, this is just the first. I've been working perfectly since. I don't know. I even tried to connect my own hotspot. I don't know. It's the network.
I think I heard someone clearly right now from the room. I can't hear you, but I think someone spoke in the background. Then I heard the person very well.
Ah.
Okay, this is
I can't. Yeah.
I tried to speak again.
okay.
Sir, can you hear us now?
Yes, someone said something. I heard the voice now, but I can't hear Dr.
I
Patrick's
think
voice, but I heard the voice in the background and it was so
I
clear.
cannot hear you.
I can't hear Dr. Patrick's voice, but I can hear every other person in the room. Bitunu, is that same with you?
I can hear every now and then. I think it's going.
Background, like a lady's voice, but I couldn't hear the chair's voice.
Yeah, same here.
Okay. Are you able to hear us now?
Yes, I can hear
Yes.
you, Prof. Yes.
Okay. Okay.
Okay.
Wonderful.
Thank
you.
Thank you. So we'll just start. All right. Good afternoon, everyone. So sorry for that brief delay. I want to especially welcome every one of us to this panel on visualizing public health. It's 10 of Red, a film by Sochima Okafor. and I'll be chairing the panel. Of course, I have other experts here with me who are very much informed about the subject, and they will speak to us, provide some sort of feedback, suggestions, and some views about the movie. We don't really have much time already, but I will just go straight by providing a sort of synopsis of the movie and then read out some of the bios of our panelists. I think we have 3 panelists in the room here, and then we have 2, Williams and Muna online. They'll be speaking to us from their locations. So I will open up by saying that we would give each of our panelists maybe 10 minutes or thereabouts to give their views, their reflection on the movie A Stain of Red. And then we'll have the Sochima, who is like the filmmaker, to respond to some of these comments, some of these views or reflections. So very quickly, A Stain of Red is a movie that tells the story of a 16-year-old girl, Onome, who experiences her first period and, driven by curiosity, set out to understand this natural but mysterious process. As she navigates the emotional and physical challenges of menstruation, she uncovers hidden truths and damaging myths surrounding it. Refusing to stay silent, Onome finds her voice and begins to speak out about the realities faced by teenage girls, particularly in rural communities like hers, which is Ebrede. This powerful story sparks an urgent conversation about menstrual equity in Nigeria and also across Africa. Like I said, I'll be chairing this panel, but I will not really introduce myself much. My name is Patrick. I'm a doctoral candidate at York University, Toronto. But our panelists include Professor Ogechukwu Williams, Esther Idowu Oluwaseun. We also have Muna Abdulrahman, who is joining us online. We have Dr. Tolulope Osayomi, and then we have Itunoluwa Williams. I'm so sorry about that. So Professor Ogechukwu Williams is an associate professor of history at the University at Buffalo and a historian of medicine in Africa with a focus on West Africa. Her research explores the intersections of colonial power, reproductive health, and maternal care. She developed a passion for maternal health while working with Nigeria's National Reproductive Health and HIV/AIDS scheme in 2010, a formative experience that continues to shape her scholarship until today. Her forthcoming book, Birth Politics, Colonial Power, Medical Pluralism, and Maternity in Nigeria, which is published by Johns Hopkins University Press, is the first comprehensive history of childbirth in Nigeria. Our second project, Dying to Bring Life, a social history of maternal deaths in Nigeria, investigates the cultural and political roots of maternal mortality from the colonial period to the present. Idowu Esther Oluwaseun is a research fellow in the Division of International Politics at the Nigeria Institute of International Affairs, Lagos, Nigeria. She holds a PhD degree in political science from the prestigious University of Ibadan, where she did an interdisciplinary study of film and politics. She has a master's degree in political science with specialization in international relations from the same university, as well as a bachelor degrees in political science from Olabisi Onabanjo University in Ogun State. She has worked as a teaching staff at the School of Foundation Studies, University of Lagos, Center for Continuing Education, Olabisi Onabanjo University, Ogun State, and the National Open University of Nigeria, where she has taught both Nigerian and African government and politics. Next on the list is Muna Abdulrahman, who is a doctoral student in pharmaceutical sciences at the University of Mississippi, United States. She holds a Master's of Science in Pharmaceutical Sciences from the same institution and a Bachelor of Pharmacy from Oman Medical College. Her research focuses on developing nanotechnology-based drug delivery systems to treat retinitis pigmentosa, a degenerative eye disease that gradually leads to vision loss. She investigates nanoformulation that can enhance drug penetration to a posterior segment of the eye while preserving ocular tissue's integrity. I'll leave it at that. And then Dr. Tolulope Osayomi is a lecturer in the Department of Geography at the University of Ibadan and currently an Oxford Touch Visiting Fellow at the Faculty of History, University of Oxford, under the African Oxford Visiting Fellowship Program. He holds a PhD in Health and Medical Geography from the University of Ibadan, and his research lies at the intersection of disease, health, and society, with particular emphasis on spatial epidemiology, global health, spatial demography, and the geography of pandemics. From 2020 to 2021, Dr. Osayomi led the COVID-19 mapping lab at the University of Ibadan, a pioneering initiative that advanced the geovisualization and scholarly understanding of the pandemic in Nigeria and across Africa. And he has several ongoing research, which of course involve COVID-19 within historical, socioeconomic, and political context. Itunoluwa Williams is a rising second-year PhD student in gender and women's studies and a primary instructor at the University of Kentucky. Her research centers on transnational feminism, gender in Africa, and the intersections of African women with law and politics. Her previous works explored gender-based violence against elite female athletes in Kenya, arguing that their elevated public status rendered them vulnerable to unique forms of exploitation. Viewed as financial assets by intimate partners and family members, these women are often reduced to tools for other gains and expected to submit to male authority. And our respondent, who is the filmmaker as well, Sochima Okafor, recently completed his MA in African History at the University of Mississippi, United States. He holds a bachelor degree in History and International Studies from the University of Nigeria. His research interests include African history, history of medicine, media, public health, and film in colonial and post-colonial Nigeria. He is the founder of Liveling Film Network and a filmmaker dedicated to using media and the art of storytelling to analyze and address public health challenges in Africa. His debut film, A Stain of Red, explores menstrual health issues in Nigeria, highlighting poor sanitary conditions, limited education, and inadequate awareness among young girls. It's quite a long bio, but I think I'll leave it at that so we can just go into the business of the day. So our very first panelist, who is Professor Ogechukwu Williams, would have to take the floor. And
sorry, Chair, we haven't introduced Muna.
Sorry, Sachima, did you say something?
Did a brief one, I guess, but yeah, I did.
No, go ahead.
No, I did. I did.
Yeah, you did.
I did. I
Go
introduced
ahead, go ahead.
Can you hear me?
You did.
Oh, can you hear us? Mona, I introduced you.
We can hear you.
Okay.
We can hear you.
We can hear
I
you.
introduced everyone on the list. I had to follow it in that order. So we'll yield the floor. I will start by asking Professor Ogechukwu Williams to speak to us about the movie A Stain of Red. And let's get her views, let's get her reflection on the movie and how she can connect that to maternal health care and the many challenges women face in terms of accessing healthcare in Nigeria and Africa. So you may start.
Okay, thank you. And Sochima, thank you for making this this film very relevant, very important film. And one of the things that I hope you will address is what your intention moving forward for the film is, because clearly this is a very important public health messaging. So where do we go with it from here? Now, one of the things that struck me in this film is the depiction of the lack of menstrual health education at even teenage years. Like this young girl experiences her period for the first time, and she had no clue what was going on. I mean, those of us women in the room, we can remember what our first periods looked like. And it took me back to my own secondary school days and my first period. Unlike this character this character is no different from the majority of girls out there. Like female reproductive health education is this thing that we don't talk about, this thing that we have to figure out. And then if your mother or an aunt doesn't talk to you about it, then you're at a loss. In my case, there was that moment in the early to mid 90s in secondary school where the sanitary pad always had massive uh, menstrual education campaigns, reproductive health campaigns in secondary schools at the time. They had pamphlets, pictorial pamphlets that kind of gave you a crash course on the female reproductive organ and what happens, what leads to a period. And that was my own introduction into all of this stuff. But at that time, they were going to schools, they were distributing those pamphlets, they were distributing free pads. And when that period came, I mean, yes, that knowledge prepared me in some ways for it. And bear in mind, outside of that circle, this was nothing that was talked about. So I could relate with this character in the film, right? But then when that moment came, it wasn't less shocking, right? I remember being in the dining hall. I went to a boarding school. I remember being in the dining hall, and thankfully it was the last day. So my mom was on the way to pick me up, and she didn't drive. She took a public transport to my school. And then I'm squatting down in the dining, we're getting ready to eat. We were getting ready for dismissal. And then I noticed the stain. Like when the title of the film is Stain of Red. It's very powerful. I noticed the stain of red on my white. Like we go home with the white uniform, the white dress. And my mom was right there coming to get me. So as soon as my mom saw me, I knew what was going on. So I wasn't like panicked, oh my God, am I dying? Am I dead? She took a piece of her wrapper and she put that around me. She got a bike, she put us on a bike, and the bike went from school to home, right? But those moments in that film, the things that didn't happen for this girl, the fact that she did not know what the belly pain meant, what was going on with her, the fact that she thought she had peed on her bed and she didn't realize it was a period until she lifted her hands, all of those things took me back to that moment. And it took me back to the fact that if there was not that always sanitary pad campaign at that moment, which I don't think it continued. Procter and Gamble continued that project, but if not for that campaign, which they did in secondary schools, I may not know, right? I may not know. Now, another powerful moment in the film for me was the main character's reaction to free condoms in the clinics, in the primary healthcare centers, but not free pads. Her argument or her anger was that intercourse is a choice, but period was no choice for girls. And yet there were no provisions of sanitary pads. There were no free sanitary pads for girls, but there were free condoms for men. So that also was a powerful messaging for me, because this is actually something that I've reflected on, not as a Nigerian in Nigeria, but as a scholar in America, because I observed similar trends, right? Where you walk into the health centers and you have free condoms. And I'm like, where are the free sanitary pads? You go into, and then for those who have them, you go into the bathrooms, you have to pay slots payment into the machine to get a small pad or tampon if you needed it. So I always thought about Why that kind of dichotomy? Is it that women are that invisible, or that women's reproductive health is that invisible? And that is part of what I hope that this film will do, because that message came across very strongly. How do we take the messaging in this film how do we turn it into a public health campaign, into something that actually shifts the narrative and shifts the thought patterns of whoever the funders of the free condoms are? Can they make room for women? In fact, at my previous institution, one of the days I walked into the bathrooms and I noticed that they had put stuff on the wall that had pads. So you could actually just push a button and the pad comes out and you could use it. They had a QR code and a number there. I actually called and texted that number to say thank you. Like, this was the first time, and I'm talking about the United States, that I saw something like that. I said, thank you. This is very meaningful. And there was a time as a professor, it came in handy. Before I had babies, I could tell that my period was coming between 1 or 2 days. Now that I have 3 kids, it could just show up. And you always carry pads in my bags. Like, you pick up any handbag, including this one, you're going to see a sanitary pad in there, right? And one of the days I felt something and I got up and, oh, well, there was the famous stain of red. I immediately went to that bathroom next door, pushed that button, got that pad. It was skinny, it was small, but it actually saved me some embarrassment, right? So these were some of the messages that this film had. I'm interested in moving forward where this can be distributed, how we can use these films, how we can push this messaging so that those who have the resources to provide free condoms can also consider providing free menstrual pads, considering that we understand the nature of the Nigerian economy and the fact that a lot of young girls have gone back to doing what this main character's mother did, which is cutting pieces of her wrapper and folding it to turn into a sanitary pad. And of course, there's the hygienic part of that. And the film showed the infections that these girls were getting, because she wasn't the only one using that. And they were scratching. They had itches in their private parts that began to disrupt. And like the film said, one of the points that the film made, these kids dropped out of school. They stopped coming entirely because of this is something that they had to deal with every month. And I'll stop on that note. Thank you.
Thank you. Thank you very much for that reflection, and also pointing out very critical, very important points to note. I'm sure Sochima heard you and he has noted those points you have raised. And also thank you for sharing some sort of personal experience to help us understand the dynamics of these issues that we are treating here today. Without taking much time, I would like to proceed to Idowu Esther Oluwaseun. We would like to hear from you as well, maybe in a couple of 5, 8, 10 minutes, as much as you can take. So, yeah, the floor is yours.
Thank you very much. Thank you, audience. Thank you, Sochima Campo. So when you sent me this, the link to the film, I loved it, considering that I was doing a research on the films, on Today Kalani's film. So I had gotten a bit of training about reviews and criticisms and all that. So then this one really, really resonates with my kind of experience. And from what Prof shared as well, I could relate with a lot of things you said. Back then in school for us, whenever you saw a lady or a student, a female student tying shirt, yes, or cardigan, yeah, cardigan, you knew that she was on a period, that kind of thing. And then boys would start embarrassing us and trying to pull us, taunt us, bully us, and all those kind of things. Yes, and then for some of us too, we had period poverty. The fact that you could not afford, maybe it was cheap then for some people, but for some of us it was not cheap. So, and then too bad. I didn't get the kind of education I should have gotten about menstrual periods. So I had to also resort to that. Of course, I had sisters, but I guess everyone was just busy about their whole life. So I had to do that format of anonymous mother, and it did not help. And somehow there was no one I could share it with. Even when I had friends, I had this inferiority complex. I couldn't just open up to anybody. So I managed to cope until I started getting better and all of that. Then this factor about missing school, about lack of facilities, about the lack of information, you may think that, oh, we're in Lagos, we're in the city, and then the knowledge is everywhere. No, it may not always be so. So even when you're in the metropole, it may not always be like that. So I think the responsibility lies with teachers and with parents to be bold enough, because some of them think it's a topic we should not discuss. For me, I have lots of horror with ladies, and at times when we even talk about sex education, I get down to the basics. I call what it is, I call it the name, I call vagina, I call penis, because I'm educating them. Because some of them, the next thing is they go to Chat GPT and then it tells them what you are not telling them. So I'm glad we have parents here. We should go to the basics, call our ladies, and educate them as appropriate. Then maybe this one is about government. My kind of orientation is to always do policy advocacy, in that we could have the government and also the private sector come into a kind of CSR. They should be able to supply, if they can supply condoms, they can also supply menstrual pads. In fact, the construction of schools right now should always have a kind of private corner where ladies can feel relaxed. I am a woman, and I have done this for how many years of my life. So it's so bad that even in the office space, our bosses don't understand. When I'm having cramps and I say, oh, I have to go home now, or oh, I'm missing work today because I have cramps. And for me, I'm not shy about it. I tell you, I have cramps. I have menstrual cramps. I'm a woman. Yeah, I'm a mother. So there's nothing hiding there. So, and then they'd be like, hey, you at this age, are you telling us you have? Yes, I do. May I go home? Yes, I don't want to die at work. So government has to provide a safe space even within the school, considering that for a good part of the day, you are in school or you're in the workplace. So girls need that safe space where they can go and relax sometimes when they experience that cramp, because for some of them it's usually terrible and like you want to die at times, and then you need the hot water bottle, you need some drugs and all that to cope. So aside having the safe space, they should also have like a box where the girls can go there and then pick something, or maybe there'll be a dedicated teacher that would be supplying them. Maybe the guidance and counseling teacher can have that box, like we have first aid boxes in schools, where when the girls come, she can give them one per day, or maybe 2, 3 per day. So government can supply this. And in fact, I was thinking while I was meditating on the film, I thought of that it could even be a pet project that first ladies can take up. All these ones they do lavishly that the whole world can hear. They can go to the grassroots, public schools, and then do a kind of private project where eventually it gets branded in their names, and then it's fine. And so they can create a small place where girls can have access to pads and all that, and whatever else gives them comfort. And also G2G, girl to girl support, because in that film, especially in the first scene, the opening scene, imagine the other girls shaming that girl. Whatever they were telling her made her feel so bad. So it's what we all do. So why are you making me feel like I'm the demon amongst you? So there should be a kind of girl together. And like Prof said too, my bag is always having it. All my bags have it. Even if I don't need it, if I don't use it, all my bags, my purses, I'm carrying you out in the next 3 months. It is already there. So I'm going out. Anyone who needs it, I quickly supply to them, or if I'm the one that would need it eventually too. So there should be a kind of girl to girl support, maybe a kind of slogan for girls. When I'm on red, you should be able to give me a code so that the next guy would not know what is going on with me. Like, so they can develop a kind of slogan or give some girl to girl support. And this goes to government again, because it's policy advocacy I like to do. That she had white uniform, right? How did you cope? Because I'm always thinking of, like, for me, even as an adult, even on days I'm on red, I don't wear colors that can expose me easily.
Black and brown.
Because unfortunately, the products they make now, women can tell, the products they make now are so terrible. They don't stick. Even when they're sick, they go sideways. It's so terrible. No, we can't hide it. Some of you are married, so you have, of course, so, and then you have sisters, and then they may not share with you, but those are the things we worry about. So it sleeps, it falls, it's and so on. So we get to, so I am advocating that government schools, if the uniform is these bright ones, they can as well make other colors for girls so that on days when we're on, we can always wear our safe clothes and then we're safe at least to an extent. Yes, subsidy for sanitary pads as well. Yeah, currently government has been, I'm talking about subsidizing drugs. Yeah, very fine, very laudable, but they should also think of subsidizing, I hope my time is off. They should also think of subsidizing sanitary pads. So there are many of them out there now, aside Always. I've not even seen Always in the market in recent times. So there's B-Sense, there is My Girls, there's Veroni. Thank you. Yeah, all of them. They can, government can even produce their own. They can have, we have government factories. They can produce their own through maybe Ministry of Women Affairs or the National Orientation Agency or Ministry of Health. We can produce ours, I mean, as the government, and then subsidize it, make it easily affordable. For adults, maybe it's affordable. I usually buy a pack, and then when girls visit me at home, that might just be the gift I'll give you. Yes, and then at times when I have the forum, I give them as gifts as well. But it may be cheap for me, maybe because I'm working class. But how about these girls? How about these teenagers? How about those ones whose parents are just trying to make life happen for themselves? So let's think of subsidy for sanitary pad. Thank you very much.
Thank you, thank you. Thank you, sir, for that reflection. Also highlighting issues of CSRO, government intervention, subsidy, and women to women cooperation. I think these are very important things that we should bear in mind going forward. Mona, are you ready for us? Mona, are you ready for us, Mona?
Voice is breaking.
Okay.
Was my name
okay.
mentioned?
Yeah. Can you hear me now?
Yes, I can hear you clearly.
Okay, good. So we are going to take your reflections on the movie. So if you're ready, you have the floor. You can do that in 8-10 minutes.
All right, all right, thank you. First I want to sincerely thank Sushima for creating such a powerful and important film and for giving me the opportunity to be part of this conversation. A Stand Up Red doesn't just tell a story, it gives voice to the silent struggles of so many girls across Africa. As someone who has experienced some of these challenges firsthand, I truly appreciate the care and ethnicity poured onto this work. It's a much needed contribution to the movement of for menstrual health and reproductive health education. I guess it was not mentioned, but beyond my academic work, I'm a menstrual health advocate. I'm part of a Sudanese nonprofit organization that actually tackles or challenges menstrual taboos and educate women on mental health and reproductive health in general. And as a menstrual health advocate from Sudan, this film resonated deeply with me. The story, while it's rooted in Nigeria, it reflects struggles, as I mentioned, many struggles of girls across Africa when it comes to managing their periods with dignity. And watching the movie deeply brought back a memory for me. When I got my first period it was a very young age and much earlier than my peers, and I wasn't prepared for it at all. No one had talked to me about what puberty would be like, not even my mother, despite her being educated and have gone through it with my older sister. When it happened, I was in shock. I didn't know what to do or how to even speak about it. It was only later, through school lessons on the female reproductive system that I began to understand what had happened to me. But that early experience of silence and confusion is exactly what so many girls still go through. And it's what makes this film so powerful and necessary. It reminds us that knowledge is protection and silence can be harmful, even in loving, educated households. So for me, if I reflect back, like I mentioned this to Tsushima before, like I look at it and it just reminds me of how menstruation is considered a taboo until today. We don't talk about it. And it's like as if it's despite it being something so natural, it's a natural process, we don't talk about it and we hide it. And we feel ashamed about it. Um, um, and I do agree with the other panelists on it, on the film highlighting a serious issue, which is period poverty, which is a global issue, actually. It's not just something that's in Africa, it's something global. Even here in the US, it's a lot of young women and girls go through it, like they lack access for affordable sanitary products. And actually in the university here, we have a whole student organization that's taking care of providing students with free pads and like period products that make it accessible for all students. Because period poverty is a real thing. And if like for me, the movie really highlighted how important or the film like highlighted how important is it to like talk about menstruation, like and treat it as something normal. It shouldn't be something ashamed of and should be something talked about. And how period poverty is something that needs to be educated about. And also like I feel like as any one of us, whether you're a mother, sister, or like you're a part of like the community as a female or even as a male, we need to like educate our community from a young age about something so normal as menstruation or reproductive health. Because if we're not so educated, then we use, for example, clothes or rags or stuff like not pads. I saw in the movie like the mother gave her daughter a piece of fabric, or I would say like a rag, to use it during menstruation, which if not washed well, or it will lead to like infections. And yeah, it's just a call of action. I see this film as a call of action to um, break the barriers and educate the community on how important that is. Because I mean, the issue is, and as an advocate and as something that's like, I would say in Sudan, for example, as because of the war, the period poverty uh, has been an issue for decades, and like it's been worsened because of the conflict and displacement. And menstrual health is often overlooked, yet it's essential for dignity and protection. So I feel like we need to screen such films and schools, community centers, and I would love to see this film translated into more African languages and used part of menstrual health education kits. And also, this is a reminder for all of us: if we want to keep girls in school, protect their health, and affirm dignity, we must break the silence around menstruation, starting at home and extending to national policy. Right. Thank you.
Thank you very much, Muna, for grounding the factors like education, poverty, and helping us to understand that the movie is trying to make us see how we can view public health through the lens of the social determinants of health. Of course, basically poverty and education, which are very critical factors to consider. Thank you very much for that. Thank you. We'll move to our next panelist, Dr. Tolulokpe Osayomi. You'll have the floor. So probably 8-10 minutes as well. We would love to hear your reflections and insight on the movies.
All right. Good afternoon, everybody. I want to say big congratulations to Mr. Okafor for this great production, film production. And I would like to share my reflections, which have been informed by my personal experiences, well, indirect personal experiences, and also from a disciplinary perspective as well. When I first watched the movie, it evoked memories of from two settings. First, from my secondary school. I remember shortly after we had a class, a classmate of mine approached me and said, "Did you notice that this lady was immobile?" I said, "What do you mean by immobile?" She didn't get up from her seat when we ended the class. I said, "Why?" And he said, it seems she was experiencing her period. So she felt and then he also observed that she was silent all through the class. So I think that for me was very moving. And that was my first realization of the kind of issues women and girls go through, right? And the second was during my national youth service corps year. I taught at a girls' school in northern Nigeria, and it's a lot that these young girls are really going through. So when it comes to, I mean, besides menstrual hygiene, there's also the issue of abortion. I recall the school had to close because they found that they had found fetus of so many, yes, around the school. And it was when the school set up a board for inquiry, they found out it was actually the school nurse who was responsible, who had been impregnating the schoolgirls. So there is really a lot. So for me, I mean, it just evokes, some of these memories that I had. There's no doubt that this movie is it's a tool of health education. And from what I observed, I was so pleased to see that when she realized that Onome realized that she had experienced her first period, she informed her mother. And her mother did not in any way shame her. All right. Yes, so that was the first person she could really confide into. But unfortunately, her mom only practiced what she had known all the years. And it was just a pity that she herself too was also a victim of all this, of the process itself, not having the proper education, proper health or menstrual hygiene and education. But going through that scene, the question came to my mind is, at what point should our women and girls be informed about menstrual hygiene? Is it at the point of their first period? Should we wait till they have their first period before they know that this is what they're going through? That's what came to my mind. And the other thing that I found very instructive was condoms seem to, I mean, just as Prof rightly said, observed, condoms are getting more attention than pads. All right. People are having more access to condoms than pads. And why is that? All right. And of course, I mean, it's easy. The reasons are not far-fetched because of, trials to reduce the prevalence of sexually transmitted diseases, e.g., for example, HIV/AIDS. But there's a lot more. All right. There's a lot more that we need to do. And then also the stigma. There's the theme of stigma and stigmatization also comes up, right? I mean, the opening scene, you see these young girls chasing Onome and then labeling her, probably calling her a deviant in the sociological sense, I mean, right? But I then said to myself, don't these girls too also have the same issues? Don't they face the same issues too? All right. So then my final thoughts, and also my suggestions to Mr. Okafor is that what is the role of male agency in all of this too? All right. After all, daughters have fathers. So what's the role of the male agency in menstrual education? And I'm so happy that my panelists here also raised the point that, it's not just a topic for women and girls, it's for everybody. And then also, the previous speakers have, touched on a very, very important point, which is increasing access to these paths. I totally agree. But looking at it from a geographical perspective, or from a geography perspective, where do we intervene? Is it in the urban areas? Where do we have these access gaps? Do we have them more in the urban areas or in the rural areas? And that's one thing the movie was also silent about. You couldn't really tell whether it was a rural area or it was an urban area. All right. But I could deduce that from looking at the general hospital where she went to seek care. All right. You only find general hospitals in towns, in urban areas. But if it was a village, of course, she wouldn't have had that kind of access to medical care. So it's very important to say that where are these access gaps? And if we are able to identify them, we can then direct these interventions to these places. So again, thank you very much for the invitation, and I wish you the very best. Thank you.
Thank you so much, Dr. Tolulope, for that reflection. I think I agree with you with the question you posed to Sochima about the male agency. All girls, daughters, they all have fathers, and what role can men also play in terms of educating? And I think I also agree with you with the fact that is it at the first experience of the period they need to start getting education, or before then? So I think I like those points you have raised. We'll work with that going forward. Our next panelist is Itunoluwa Williams. I'm sure she can hear us from here and she's ready for us.
Hello, can you all hear me?
Yes, we can hear you. Please, you have the floor now.
Okay.
Thank you.
All right, thank you. First of all, I'd like to congratulate Sotima on this movie, on this film. Always proud of your achievements, and I feel like all the other panelists have already done so well. So a lot of what I'm going to say is just going to be reiteration of their former points. I think two things that really struck out to me in this movie was one, Onome was a school-going girl. So there's already this assumption that, she's getting education, or at least she's going to school, so she should be more informed. Yet we're seeing that even though she is a school-going girl, she still has no knowledge about menstrual health or reproductive health at all. So showing us that even educated girls are lacking, knowledge or any perspective on, menstruation or their reproductive health, showing us that like there's definitely something that's wrong with the educational curriculum, and that needs to be addressed as well. I think this is something that was already previously talked about when do we start talking about these things? Is it at the point of the first menstruation, or should it be before? I know in my own personal experience, I can remember, thankfully, I had a mother who, talked to me a lot about all of these things, so that when I did have my first menstruation, it wasn't a situation where I was completely surprised or I was scared about what had happened, because she had already spoken about all these things. And I remember also that, I'll go to school and I'll, talk about this with my friends, as young girls comparing each other's bodies, like, oh, I'm going here, I'm going this. And, these were conversations that we had. So I was really surprised as well in the movie that, the girls were shaming Onome, which makes me think of what kind of conversations are girls having, even in informal settings. And I think this goes back to, this culture of silence and invisibility that, Dr. Williams and also Professor Ido have already spoken about, that we're seeing even among girls where it's supposed to be a safe space for Onomed, that it's not a safe space. And we need to address that. We need to address this culture of invisibility. This should be a space where we're able to talk about things that maybe in a broader setting. You might not necessarily be able to, but you should at least be able to discuss this here. So we need to reevaluate things that we say we should keep hush hush. We need to be able to speak about these things, at least so that at least in on a mess situation like that, education, that knowledge would come through and ultimately will be able to help her experience. Um, Everyone has spoken a lot about education, and maybe I'm going to take a bit of an opposite view to that. So yes, I completely agree that education is very fundamental. Um, you see, of course, that it's fundamental both on the home front and also in the school front, because clearly there's a lack of education on the school front, and also we see that even when Onome does tell her mom and she learns about menstruation, this doesn't solve all of Onome's problems. She still is lacking. She's still very confused about her body. She's still very confused about sexual health, about reproductive health. So I think it goes back. We also need to think about what topics are being educated on, and who is doing the education. And of course, like I think Professor Osayomi also discussed this. Like we see that the mom's education herself was also deficient. So ultimately that also affected Onome's education. So we need to also pay attention to who is doing the education and what experience or what knowledge they have on this topic. So I think this is a question for Sochima, but of course it's a broader question for all of us as well. Is that we see, of course, in the movie we see that education doesn't solve all of Onome's problems, right? And I'm so grateful that Sochima did not gloss over that or whitewash that in the movie to, say that, oh, education solves all the problems. No, it's just a starting point. So how do we move beyond education? And I guess a follow-up question to that is how can we show that a lack of access or accessibility is also important, maybe even as more important as this lack of education on menstrual health itself. So those are my few points. Thank you.
Thank you so much. Thank you so much for that reflection. I just want to appreciate all our panelists for the feedback, the reflections they have given so far, and all the points they have raised. We've heard them, talked about the issue of May agency. We've also heard about CSR. We've also heard about policies, government policies intervention. We've also heard about campaign awareness, education, and quite a number of issues that Stain of Red is also calling us to think more deeply about. I would like to give Sochima Okafor maybe the next 10 minutes or 15 to respond to some of the conversations that have been raised by the panelists, and also perhaps if he jotted down any of the questions they've raised, like the one Dr. Todulokbe raised about May agency, and also Itunu Oluwa. I would like to give him the floor now to respond to some of this conversation before we proceed to open the floor to our audience to either ask questions or also give us some further reflections on the movie. So Chima, if you can hear me, you have the floor for the next 10 minutes.
Thank you so much. Can you hear me clearly?
Yeah, we can hear you. Please go ahead.
Thank you so much, Dr. Patrick. Thank you, everyone, for making it possible, for ensuring that this conversation is happening today. I'm so grateful. I'm so grateful for your attention today. I mean, when I decided to bring a Stain of Red to LSA, I was initially, but thankfully enough, when I did reach out to each and every of the discussants today, they didn't even say, let me think about it. They said, I'm in, they said I'm in before even asking further questions. And that I'm very grateful for. Especially Professor Gechuku Williams. Before I reached busy as a professor, she's into so many research works, and I wanted to add that would be me adding to her plate. So, but she said, this is impressive, I'm interested. So for that, Prof, I'm saying thank you to you. It is a thing of joy that started as a dream a few years back. I've always been interested in media. I've always loved film, but I didn't know how to marry that with history as a discipline. That has been my initial problem. And I struggled all through my undergraduate days trying to fix these pieces together. Did I figure it out at that point? No, but one thing I know is that my undergraduate mentors really played a vital role because they encouraged me, especially my first project at the University of Nigeria, where I looked at filmmaking and nation building. Because trust me, Staying Afraid is a nation building project. Women health, women reproductive health is a nation building project. When we talk about citizenship, or migration or anything that has to do with politics, because it is high time we begin to look inward. Our body is our first brand. Your first brand is your body. And when you cannot take care of your body, when the brain, the body, when the soul, mind, and body is not in sync, I don't think any other thing can work. And then when I got to University of Mississippi, I was still picked up. I began to read books. I began to read some literary works. And I realized that film in America and in the Europe, in the early 19th centuries, has always been for public health issues. Americans used film in first and second to educate soldiers on STDs, on not to invalidate the effort of filmmakers in Nigeria. Of course, they are doing well, but we are not really doing enough when it comes to public health. I go to YouTube, and then I tell myself, what if we start making films on public health? What if I go to YouTube discussing about waterborne diseases, or I see people talking about cancer? That is nation building. And with the help of my professor at the University of Mississippi, Noel Wilson, although she's not here, he said, you have 10 years to make it work. You have 10 years to make film and history work. And after 10 years, if it doesn't work, change into another thing. And in less than 1 year, I took her advice, and today I have a Staying Afraid. And I'm very grateful for all of you that has come here, and I've heard your different perspective from each and every one of you. And trust me, you have even opened my eyes to the things, even as the filmmaker, I didn't even look at them that way. I was just writing. I was amazed to the kind of intelligent output that you people have just brought up today. Now, addressing the questions, how do we make films? How do we make those films to fund into public health campaigns? I have tried my best. Even in America, I've been going to schools screening this film. It has been screened at so many universities: University of Mississippi, Florida International University, Clark Atlanta University in Atlanta. I have tried even at one NGO conference in Nigeria, was a West African secondary and primary school, including universities, to ensure that this movie gets to everyone that it can get to. Because as a young boy, I grew you should be able to watch my film. You don't need to subscribe to anything. And that is why I'm very happy that Staying Afraid is on Foursome channel, where anybody can access it without having to subscribe or without having to pay, because my interest is that the message, everyone gets the message. And then moving forward, like Professor Ogechukwu asked, what is the way forward with this project? If you watch Staying Afraid closely, you will know that there are many ways, there are many angles to women menstrual health, or to menstrual health, sorry. This is a one-side story. I'm currently working on a documentary because I am also interested what is the experiences like? Because with Staying Afraid, we are looking at rural area, we're looking at young girls, because right now in Nigeria, people would rather spend their money on food than to spend thousands of naira on sanitary pads. And because of that, that is why these young girls resort to alternative measures. You could see them stealing tissue paper from school, and that results to them itching. A lot of them, because of their young age, they don't even know how to wash those fabrics. They reuse it, use it again, wash it carelessly, and it leads to itching and so many other health implications. So the challenges of menstrual products in different contexts, the rural areas, the urban areas. What is the difference? How are these people experiencing this differently? And I'm also interested because right now that I'm conducting some interview, I realized that some of the young girls that I'm even working with, they are living with their mothers. And one would expect like a mother like Onome's mom would sit the daughter down and tell her the real story. But as we can see, just like one of the discussants pointed out, that Onome's mom is also a victim because what she passed to her daughter forward with the film. And then the next question, at what point should girls be informed about menstrual hygiene? That is another important question that this film is raising, because in my current speech on or public speaking on menstrual health, I am saying, if as a girl, your boyfriend cannot buy you menstrual pad, or he is shy to go to the pharmacy to buy you menstrual pad, you need to rethink what you're doing with the person. Because even young boys at home, it is high time everybody gets involved. A few weeks ago, a popular Nigerian blogger was doing something about, they called it 30 days rant challenge, calling Nigerian government on what they are doing, how the country is just falling apart. And then a young girl used her phone and made a video that she can no longer afford sanitary pad. That right now, she would even want to eat. She doesn't have money for that. And then I decided to check the comment section on that post to know what people are saying. And someone said, why are you discussing something like this in public? Go and use plantain leaves. That was even my first time of hearing that plantain leaves can be used. Some people are using plantain leaves. And then I got curious of the gender already. So we don't need to wait for young girls to get to the point of menstruation before they get this information. It is high time parents, because the first agent of socialization is family. And whatever they learn from family, they take it to the peers and they go to school, and it keeps going like that. So if a parent cannot boldly tell the daughter what is happening, look at Onome's mom. One of the information she gave Onome is that henceforth, when a man touches you, you get pregnant. Is that really what makes a girl pregnant? It's not. And in her own quiet moment, she started reflecting. Oh, this person touched me the other day, even when she was almost a rape victim. She didn't get pregnant. And she remembered some young girls. They didn't get pregnant where people just touch them. I expected Onome's mom to tell Onome what really makes a woman to get pregnant, instead of saying henceforth, when you're touched, you will get pregnant. And then this also ties to the question of what is the role of male agency in this whole issue? I am seeing myself as also playing that role already. The first opportunity I had to speak about Estelle Fred, she reached out to me. She said, oh, that she has been reaching out to a lot of people, and it appears she would end up having only women in her panel. And when she came across my post on LinkedIn, she was surprised that a man is doing something like that. That is male agency doing something already. You don't need to be a woman. Look at the chair of the panel, is a man. Dr. Tolulope is a man. So how about we just finish at the end of this conference, we go home and continue. Let Estelle Fred conversation let it not end here. When you go home, what are you telling your daughter? What are you telling your son? What is the conversation you'll be having with your wife henceforth? Even myself and the younger ones in the room, in the audience, or watching anywhere, you will get married, of course you will procreate. What would a stain of red tell you? How would that reshape your parenting? And how can we move beyond education? Yes, right now we've seen that even Onome, like Itunu pointed out, that's a salient point. That she's going to school, and one would expect that she should have been taught. But it wasn't mentioned. No one talks about it. 2 days ago, I discussed a of Fred in a panel in LSE, and a scholar asked how come Onome knows a lot about sex and sexuality, but she knows little about menstruation. Yes, that's a very important and very valid question. But the truth is that if you go to Instagram and YouTube, everybody's talking about sex. Even young boys, nobody, even myself, I can't remember having to have used my phone to browse, oh, what are the things I can do to keep myself fit and be healthy? But we always go and check a lot of things about these other things. So they talk about sex. They approach on their fellow young boys and other things, but they don't talk about menstrual health. So it is very possible that Onome could have known a lot about sex without knowing anything or not knowing anything about menstruation. So I think for me, Extent of Red is not just a movie. It's not an entertainment film. This is a project that I'm looking forward to seeing it being incorporated in school curriculums where young girls it's a film for everyone. Watch it and also know what you can do or make out of it. I'm a historian interested in public health and film. I'm creating a space where public health and media would marry each other. Because right now, I know that the generation is kind of degenerating into audiovisual. People still read, but they also watch visuals. So I think it is high time we begin to look into this other aspect of scholarship to see how we can also make these things available. 3 days ago, I was in Dr. Ogechukwu Williams' panel, and they're talking about maternal deaths. And that's an inspiration for me. That's an inspiration. Beyond the writing, what else can I do? How do I bring it to the screen? How do I teach people about maternal deaths? So I appreciate everyone. Extent of Red is not just for me. It is a movie for every young girl out there struggling. Just know that I can hear you. We can hear you. And I don't want to start repeating everything about the film. The panelists have already done that. But I'm saying that this is not the end. This is just the beginning. And I also want to point out that I am not a specialist in women health. I am interested in public health in general. And it is one story at a time. Today is women health, is menstruation. Tomorrow is another thing. But it is one story at a time. And that is me as a historian bringing media and public health together. Thank you so much. Please unmute yourself. We can't hear you.
Am I muted? Okay, good. Thank you very much, Sochi. Thank you so very much for that wonderful response. And you were able to, tackle or respond to all the points that were raised by the panelists. I know we have quite a number of audience online. We also have in the house here. And I know there will be a lot of questions for you, but I would like to give our panelists just one more opportunity to follow up with some of the responses you have given us. Mona, Mona, can you hear me? If you are ready to
Yes.
speak, you can just take the next 2 minutes probably to follow up on that response. And if we have any other panelists in the room want to say something, we'll also give you 2 minutes to do that. Thank you.
So I guess I can.
Yeah, you have maybe 2-3
Talk.
minutes. Yeah, you can go ahead.
Right. Thank you so much, Tsushima. I guess I guess from experience, I would say as a mental health advocate, when it comes to I like the fact that you raise a point like we should not wait to educate girls about their what goes on to them like until it happens. We should be educating girls from a very young age. And as an advocate, I remember so when my friend and I, we started this initiative in Sudan, because we were trying actually to promote sustainable most health products, not pads. We were struggling with the process of pad. We were thinking, oh, what stuff can be used instead of pads? What other options? So the Sudanese market, and I'm not sure about the African market in general, but the Sudanese market did not have sustainable products like here in the US, which we kind of have like menstrual. So we started educating women on social media, starting with a Facebook group on, hey, there's like menstrual cups, period panties, stuff like a sustainable that can be used, and you can use it's much more better alternative when it comes to beds. Like you don't have to worry about spending a lot of money. So it's much healthier. So when it comes to educating, I feel like for me, we started with community workshops, like not just on social media. We went out there, like we went to schools, we collaborated with people, so everybody could do something. Um, um, and it's, yeah, I should like. Well, at first we started for all the community because everyone is involved, as you said, as a parent, as a brother, as like, yeah, as part of the community, you need to like do something about it. And it's nothing to be ashamed of at all. Also, there could be initiatives like making like a local pads, like cloth pads that are more sustainable, or because when we talk about period poverty, lack of access because of it could be something you cannot afford at all, actually. So having a sustainable option would be much better, as I mentioned earlier. But yeah, for me, I think there could be a lot of steps all of us could take. So from starting a conversation, like a small conversation with like someone, your peers or whatever. So and then yeah, to the community. So yeah.
Okay, thank you, Mona. Thank you very much for that follow-up. Thank you so very much. Do we have any of the panelists in the room? Okay, Shewun, you want to say something? Please, can you keep it at 2 minutes, 3 minute maximum? Please. Thank you.
So my observation is that for every point of growth, physiological growth for a woman, it comes with pain. Yeah, from growing breast to having the real menstrual period to getting pregnant, having babies, then the perimenopause, and then the menopause. Everything comes with pain. So I just want to say that men should be kind to us. Thank you. Show us some love. Yes. And then for us women too, please. Women support women, WSW. And the next time you're giving a gift, whether you're a man or a woman, please include a pack of sanitary pads. We would love it. Thank you.
Okay, thank you very much. Oh, you want to say something?
Yeah, I just want to add quickly, the pad idea is actually very powerful. At some point, over the past couple of years, at some point, whenever I come back, my sister says, just buy me pads. You know how much I spend to get me pads. So I go to this large membership store where they sell they sell it in huge quantity. You can buy it. I buy this pack and I come back with it. I just push it into different parts of my bag, my luggage, and I come back with it. And she gifts it to other girls as well. And it's such a wonderful gift. And I do want to add that one of the observations that I made from the responses with Onomi's mother, it wasn't just about the miseducation or the lack of education that she received or didn't receive. It was also plain period poverty. It was about access too, because she tore that piece of wrapper. And she actually, this was a wrapper that she actively used it. And she was tying, Onome made a comment and said, my mom ties a torn wrapper now because she had to tear a piece of her cloth to give me to use for period. So it wasn't just about the orientation that she received. It was just that she plain could not afford anything else, that she had to tear not a rag, but a nice wrapper that she's actually using, and she's now tying the wrapper torn. So that's something that I wanted to point out.
Oh, thank you very much. We still have about 16 minutes. We will open the floor right now for questions. And okay, I see one hand already. Please, if you have questions for us and you're online, you want to drop it as a message, we'll read it out here and then Sochima will get to respond to that. Please, I just want to ask those of us who will be asking questions, please, very, very concise, like straight to the point. So I'll take you first, I'll take you second. Okay, I'll take you third. We'll start with those three, please.
Okay, I'm going to be brief. My name is Kunfe. I teach at Child Health, University of Ibadan, and have been teaching and researching child and adolescent health. So, one, I want to thank the filmmaker for making this film, and I want to say that I'll be willing to screen this film in my class. And I hope he will be happy to hear that. Then, secondly, the menstrual health is actually, maybe in my state, incorporated into the curriculum now in schools. And even though there's still a lot to be done, and then the issue of menstrual poverty is way beyond the way we are taking it. It's really bad. In the last 5 years, we've been trying to profile prices of sanitary pad because we're trying to push this reusable pad and with the government, and it's like there's a conspiracy against women. Nobody is really willing to fund it because we can teach girls how to make reusable pads with the hygiene and everything like that. And between the 5 years, I think the prices of different pads we have about 10 samples have increased between 62% to 180 something percent in price. And you know, the poverty margin when it comes to menstrual poverty between the rural and the urban is not really, it's insignificant. Everybody is poor. Even people you are not even expecting to say they're poor, there's a lot of menstrual poverty out there. And I want to say that we need to really push this. And then the last thing I want to say, why should I be ashamed if I'm on my period and my clothes is stained? I think we need to go the bold way. Yes.
Thank you.
Thank you.
Thank you very much. So I'm sure you heard what she said. She would love to screen the movie. So she'll get in touch with you. Victoria, could please.
Just like I've told him this before, and I'm saying it again, so it will be re-echoing so that you do it. So what I suggested when he filmed this at Arthur, Mississippi, was I was interested in regions because of rural areas, special differences, right? So because part of the comment I made was that from that film, it was, we could deduce that Onome's mother, is not quite educated like that. And then she's just like one of those rural women, what she did, right? And then my concern is now on the rural areas, women. That this film is very important, but for us to reach the rural areas, that I am suggesting language. I suggested to him that part of the project or part of the concern you're interested in is making this thing, into vernacular, into indigenous languages. That if you come to northern Nigeria, for example, they have, when you see WHO or these things, picture poverty in Africa, they kind of, picture that region very well to show the big ignorance, happening in those areas, right? And then part of the major problem that even Nigeria have in that region is still language barriers, right? You find out that majority of people do not understand English language or something, and even including vernacular. Because I know I said the national, people don't. So my suggestion, not really the question, is in future with language barriers, be accessible to people and able.
I think their voices are fluctuating right now.
Yeah.
Please, can you work on the voice, the mic? I can't hear you.
Okay, so just yeah, it is another one.
I heard the other two people, but I can't hear you.
Maybe someone can speak.
No, I know you are talking, but I can't hear you. I can hear Dr. Patrick,
Okay, good, good. Okay.
but I can't hear you. I can't hear you.
Okay. Yeah, thank you so much. Really wonderful session so far. I just want to have just a very short quick. I want to ask. Mental health is a global issue, not in Nigeria, also in Africa, sometimes BBC, talk about how female students are like dropping out of university. And so my question, what's the role of social media and technology in how we can help to like combat this issue of mental health, and how can we utilize social media, not just like having a YouTube, because not everybody can have go on YouTube. I have to use the right area. Access to this and activity. Which are happening now. And of course, there are the very as well. So how can like today and we just use social media and like great and people like even with ability, are blind or even other like health conditions, how we can have access to this.
Even though, can you hear me?
Yeah, we can hear you.
Can you hear me?
Yes, we can hear you.
Even though I couldn't hear you clearly, but I know you're asking the role of social media. How can
need to allow you to
role?
and then you will respond as well as people online.
Okay, okay.
So just, I saw your hand. Obiano Ju Njoko, um,
Oh my God, I can't.
Sachi, I think they can hear you. So if you want to go ahead and respond, at least
Yeah,
at least they'll be able to hear you.
I think they wanted someone to ask another question before I respond.
someone raised up their hand. Okay, something like that. Please.
You can promote Obianuju to be a panelist. That way she can speak.
Exactly. Yeah, Obiano,
Yes, I can hear you. Can you hear me now?
Yes, I can hear you. We
okay.
can hear you.
Good morning from here, and thank you very much to everyone who has spoken. My name is Obianuju. I'm a professor at the University of Mississippi. I know that very salient points have been raised. Congratulations, first of all, to Sachima for this very amazing movie. I know that the various points have been raised, but while the conversations were going on, I was thinking about the lingering stigma surrounding role religious bodies could play, especially considering how influential the church, the mosque is. Without being very specific, I think about, for example, the uncleanliness that is associated with periods in some religions, right? Where when you're actually in your period, you're not supposed to actually participation in that space is a way of derailing the prayers. And it just made me begin to think about how that destigmatization can begin from religious bodies. Do we perhaps see any role the church could play? Because I know that religion, the church is very powerful. For example, the mosques are very powerful. People go to church every week in mosque every week, and they listen to their pastors, they listen to their imams. I'm just wondering if this is a very effective route we could take in terms of, first of all, having open conversations about periods, destigmatizing periods, and also facilitating period education within the context of Nigeria, at least. Let me not be too ambitious. Thank you.
All right. So, we have just 4 minutes more. So I don't know how you're going to do this, but can you just tie your answer? Response on.
Can I respond now?
Yeah, please go ahead.
Okay. Thank you so much thank you everyone once again. Yes, I am very open to have this film screened anywhere. It's online. If you can't screen it online, get in touch with me. I would share you a copy directly so you can share it. You can use it anywhere you want to. And then the role of social media, I don't know if that's the question, but I think that's the question the young man asked. Yes, of course, social media is a very important tool. Is a vital tool that we can utilize, not just for menstrual health, but for social changes, societal issues. Because right now, I'm not saying people should not go to TikTok or Instagram to dance. You can go there and dance and do what makes you happy. But how about we begin to also utilize these platforms for, societal issues of this problem that we are facing today? Of course, social media plays an important role. Like I said, in few weeks back, I saw a young girl who came online and said she can no longer afford sanitary pad. And someone in the comment section is telling her to go and get some plantain leaves to use. So that is social media. Instead of coming up on social media to throw tantrum on someone or to insult someone, why can't we utilize that space to help? We can use it to help, right? So social media is very important. It's a vital tool. And of course, it has a wider reach. It reaches everyone, and people can also get information from it. And now to Professor Obianujun Joko's question, lingering stigma surrounding period. Can you hear me? Yeah. Can you hear me? Okay. So yes, the religious authority, the religious authority have a role to play. As a historian, I was taught that even Treaty of Westphalia of 1648 separated the church from state as politics. The church still has the role they play politics. We see Nigeria where when politicians are coming out for elections, they go to church because if you have this crowd, you know what it means for you. So of course they do have a role to play. And when you go to the church, it's Christian women, the majority of the population there. CWO, what are mothers? Mothers can use that opportunity, to speak about this, even in August meeting, like Catholic women. About to come there and then it's menstrual health you're talking about. Begin to teach mothers how to young girls at home, period and everything about menstrual health. So I think both Imam, the church, that's another angle I would look into. I'm very grateful that you brought this up today. And
Thank you very much.
I think that's all, right? I don't think there's another question left unanswered. And then the language, yes, the language. When it comes to language, that is something I would work on as well. Thank you, Miracle, for pointing that out again.
Thank you. This Tanya or visualize is staying the same mindset. Thank you very much for coming. We will take the conversation out there. Thank you very much. Bye-bye.